Today, the guest lecture by Professor Naresh Singh will be on specialty health and development because Professor Singh's work has been in the intersection of spirituality, health, and development. You will find it very soon. Now, I have the honor to introduce our guest. Uh, Professor Naresh Singh, I was so fortunate that when I came here, I got an email from Professor that they're working on transdisciplinary approach to higher education. I got intrigued because my PhD was also on transdisciplinary, and then I realized that actually maybe before I went to school, Professor Naresh has done his PhD in transdisciplinary science, and his work actually challenged many powerful organizations, including pharma companies, and made a significant change on the ground. And I got the opportunity to work with him on a paper. In this university, Professor Singh is serving as a professor and executive dean for the Jindal School of Government and Public Policy. I'm sure you know about the school. We had another speaker from that school. He's also director of Center for Complexity Economics, Applied Specialty, and Public Policy. And he recently published last year. He published a book, an edited book on applied specialty and sustainable development goal. And I thought that Professor Singh would be really interesting person to help us understand in more detail how spirituality is being used or spirituality is helping leaders in sustainable development goal and human development and global health. He also co-directs the Center for Legal Empowerment for Poor, and he's a senior fellow at the Jindal India Institute, which we started recently, and it's doing tremendous job. Most importantly, Professor Singh has a long experience. He had a long career at UNDP and with the federal government of Canada. And I think his experience is going to be really, really important and interesting for our program. Not only for this course, but for the entire program. I was looking for this opportunity for a long, and I got this to get him in this session. So, sir, I will stop here. Please go ahead with your presentation.
Right. Thank you. Thank you very much, Abdul. So let me share and proceed. So let's see now. I can share, right? So yeah.
Yes, sir. Yes.
Okay, you should be able to see my slides now.
Yes, sir. We can see it.
Okay, let's put it on slideshow. All right. So here we are. I just would, thanks very much, Abdul, for inviting me and for going through my CV as well. 2 points in the CV are perhaps more relevant that I will highlight. That's probably not in the CV. One is that I taught on the Masters in Public Health, the MPH program in the School of Medicine at Boston University, summer school for 17 years, in the certificate in international health. And also, when I was the Director General in the Canadian International Development Agency, part of my portfolio was social development, which included health. So that's sort of like, and I sometimes forget, I was director of the Caribbean Environmental Health Institute in the Caribbean. So that's a little bit on my health background. So let's get going. So first thing is that I am talking about secular spirituality. I am not talking about religion. So that's the first thing. So people normally start, what is secular spirituality? This is more practical, it's non-religious, it's about the human being trying to understand their own true nature. In other words, the inner dimensions of human consciousness. And so it relates to ethical behavior, yes, but it seeks wholeness. The way you look at the world is not through the typical fragmented approach, but through an essentially whole. The word holistic and integrated is not the same. So when we say whole, human beings are so fragmented in all that they do that they seek to build a whole by bringing the fragments together, and then they call it a holistic approach. But seeing wholeness in the world is a different thing. You are seeing that wholeness as it is rather than starting from pieces and bringing it together. So that's the first big point. If you can remember that, you have already understood what we mean by secular spirituality, which is what we will deal with. One of the implications of this is that there is an illusion that we live with because we fail to recognize the connection between human and human and nature. Over time, we have come to feel separated from nature, and we have therefore developed a civilization in which nature is there to be dominated and exploited for our benefit, which is what we've been doing for a long time now. And we have now reached a point in which we are calling it the Anthropocene, in which humans have such a major impact on the planet that it is destroying the life support systems of the planet. This separation of self, human to human, human to nature, is an illusion, because if you look at it carefully, we are clearly an inherent part of nature. So it is not for us to protect the environment or defend nature. It is ourselves. So my PhD is in fact in environmental sciences, long time ago. And when I finished, I realized, or during my PhD, that environmental management was a kind of a oxymoron. What is required is human management, not environmental management. The environment is quite happy by itself. It's so creative. It is the magical, what somebody called it, I think this is Richard Dawkins, call it the greatest show on earth. Our friend, the complexity theorist, Stuart Kaufman, calls it a new conception of the sacred, just looking at biological creativity on the planet. Now, science, as well as the wisdom traditions, Buddhism and others, and secular traditions, and teachers like David Bohm, a theoretical physicist, Krishnamurti, who was a great teacher, but separated himself from religion, all teach us that we have a shared consciousness, and Thich Nhat Hanh is really good at explaining Buddhism from the perspective of interbeing. This connection is what we are working with, that we emphasize. This kind of understanding leads naturally to coherence and compassion. And what you are finding in the external systems, health system, governance, development, all suffering from this fragmentation, exploitation, and so on. And we are busy trying to correct the symptoms. So in our work, we have gone deeper and tried to find the source of the problem rather than spending so much time on the symptoms. Like everybody else, for 30 years in my public policy career, I have worked with symptoms. I got tired of it. 10 years ago, I wondered, why is it that humanity is failing to do what it says it will do, like climate change, for example, in which I have spent 30 years as well. So in contrast to religious spirituality, secular spirituality does not depend on any doctrine, any belief, any dogma, or any ritual. We don't ask anybody to believe anything. It is a secular, scientific, and a spiritual approach. So it draws from existential awareness, contemplative science, neuroscience of compassion and attention, and I can give you long lists of references on all of this. The neuroscience of compassion, for example, we have an excellent and a friend out of California who is a neuroscientist, and he was the chairman of the Dalai Lama's Foundation. He's written treatises on the neuroscience of compassion and so on. So all of this contemplative work, John Kabat-Zinn at Harvard has made contemplation, mindfulness, a whole science on its own. He started from Buddhism, but he was getting no traction. When he went more neutral, then he made a revolution. So what's the rationale? Why does global health need this inner dimension? We use a concept of wicked problems. Wicked problems are problems that don't seem to have any solution. They have been there with us forever, from the time the cradle of humanity. Poverty. Now we have climate problems, health issues. We cannot find a solution. There is no stopping. It just keeps going on and on. So the traditional ways of solving problems, where you define a problem clearly and you find a solution, that does not work. Climate-linked disease burdens, mental health crises, inequality in the economy and in social structures, burnout in health systems, and so on. These we call wicked policy problems because they can only be tamed, they cannot be solved as such. I mentioned already these fragmented worldviews. We have just finished a book manuscript called From Fragmentation to Wholeness. So we are hoping that we can influence a deep rethink of how humans address problems such as health problems. But now I am thinking more in terms of human health, planetary health, and social systems, seeing them for what they are together, not fragmented as most approaches currently see it. So we are in a system that is called reductionist. It's health by a biomedical approach in a way. And for me, that marginalizes meaning, purpose, and community. I'll just tell you a quick story. When I was teaching at Boston, I would start my course, and most of my students were medical doctors. They were physicians and very senior ones. So many of them had just become chief medical officers in their countries or were about to be promoted. And so they needed now a health policy oriented course, which I was teaching. So I would start by telling them that the problem with doctors, physicians, is that they know a lot about disease and very little about health. And they would get pissed off, of course. And then we would have a little fight for 5-10 minutes. And then say, all right, don't get too carried away. What I'm talking about is that health is not merely the absence of disease, but a complete, balanced sense or a state of well-being. And you know where I'm taking that from, right? That's from the WHO definition of health. And then we will work together for the next few weeks in that class. So that's where I'm coming from. I see health in this whole kind of perspective, and that's what I'm talking about. And the WHO, One Health, planetary health movements, and so on, are struggling to take that understanding and so on. So we are going to help to provide a deeper frame for to give energy to these already international ways. So how do we make a contribution to this, take this thinking and bring it to health? So one pathway is enhancing compassionate health systems. So now we are talking of mindfulness-based compassion training for health professionals. And there is a reference there that one can look up. You will find it easily. You Google Scholar so can easily give you on this topic by West and others, which has been shown to reduce burnout, and it increases empathic engagement. Applied secular spirituality reframes care from transactional to relational approach. So now we are seeing healing as wholeness restoration rather than disease suppression. You know, Canada, and we have two Canadians here with us, we have something called the Ottawa Charter of 1976, which was one of the, I think, the first country in which the health care budget, part of it was on promotion of health as distinct from traditional health care. And that change in health policy, where part of the budget of the health ministry is on well-being, health promotion, lifestyle, and so on, was quite a progressive move even back in 1976. So then what we end up with in the world today is we are talking of this deep inner understanding and how it influences public policy. So we end up with having to think about these systems as separate, but they really are not. It's one system. Our inner system, us and nature, is the same system. But we have to deal with people where they are. And so we talk about integrating inner and outer determinants. And spiritual literacy, which we have to, of course, and we are running courses now. We are teaching graduate students in this area and doing short-term training for education, and we are doing short-term training for policy making as well. So they begin to understand the basics of complex systems, which is not important for this, and then seeing feedback loops between inner states like stress and fear and greed, and how the conditions that we observe in the world, inequality, violence, ecological degradation, intimately connected and linked through feedback loops. So I have a paper written with one of my students, a graduate now, she's doing her PhD now, on using causal feedback loops for SDGs, for example. So you will notice that our center is on complex adaptive systems. We believe that this is a natural framing to understand and do this work. So one big area is mental health. And we know, I mean, I think WHO and others are talking about a mental health pandemic. As you know, mental health is thought of as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, work well, and contribute to their community. And that is being challenged. And so the individual resilience, emotional regulation, and so on, with collective contemplative practices, dialogue, reflection, shared silence, and so on, can really help in making the connection between inner and outer and promote mental and collective well-being, and not have to rely on more and more drugs. I mean, when you look at psychiatry, it is the most underdeveloped of the, I would argue, from my perspective, others might have a different view, underdeveloped aspect of medicine. And I find psychiatrists do not have either deep experiential knowledge nor theoretical knowledge. And I think many of them will accept that as well. They have, in fact, been spending their lives working on something called the self, and that self doesn't exist. There's a book called Self-Delusion. Take a look at it and all the scientific evidence to show that the self, i.e. the ego, is an imaginary thing, but we all live our lives believing that. So ethical and value-based global health governance becomes really important. And so applied secular spirituality is about restoring ethical intentionality. So you are moving from a thinking on instrumental cost-benefit frameworks to a more compassion-centered health policy. We are talking about re-embedding, global health in human solidarity and planetary interdependence. So the issues like the UN's One Humanity and SDG 3 they are pillars, they are there in the system, in the global system that we can build on. You might be familiar with the UN's One Humanity. So we look for what is already there that we can build on, because we see the world as a whole, deep interconnections between human and humans and nature. And one of the interesting connection points is the UN's One Humanity that is there. And what they are talking about, I think the Secretary General speaks about 8 billion people, one humanity. And the Agenda for Humanity has proposed 5 core responsibilities that we can use and build on. Global leadership to prevent and end conflict, upholding norms that safeguard humanity, leaving no one behind, which we know very well from the SDG agenda, changing lives from delivering aid to ending need. That's a big one. I've worked in Yemen for several years, and one of the things that we did was to set up a sustainable livelihoods program, because the international system was providing humanitarian aid. I think it was worth about $2 billion a year to feed 24 million people in Yemen. And we were demonstrating in those patches in Yemen in which we had enough peace, so we were not being bombed out, that people could rebuild their lives on agriculture. So they had bombed out all the power. There was no power left. All the power stations are gone. So we introduced solar energy to solve that problem. We went back to agriculture, to livestock, to agro-processing, cheese, milk, all of that, and then started to spread from the various little small wins with various patches. And the argument was, when people can take care of their own livelihoods, it is 10 times better than when you have to provide handouts. The first big thing is that you will cut your budget by 50% in 3 years, and you will end delivering aid, humanitarian aid, after a while. That has to be the approach, because no aid community can afford to continue indefinitely to spend $2 billion in one small country. And that leads to building a more inclusive and sustainable world. So in other words, we take some of these UN type understandings and vision and statements and give oomph, give energy to it by a deeper theoretical and practical framework, as I will show you. Here are a bunch of illustrations that I think illustrate what we are trying to talk about. The Bhutan's gross national happiness model, I think, integrates inner well-being with health policy, and so on. Then there is the compassion cultivation training. I went through the concept of secular spirituality, which you heard.
Yeah.
So that's the definition, and the illusion of separation between us and the world, the fact that we have a shared consciousness, and so on. And then we look at inner coherence and compassion, and so on. So we have discussed that. You will get all of that. Then the rationale, while global health needs the understanding of the inner dimension. I've explained all of it. The slide you will get. Then I will just jump ahead because otherwise we run out of time. And I was doing these case illustrations.
Yes.
But you heard my explanation. I hope it was clear.
Yes. Yeah.
Yeah. So you will get the slides, and now here are the case illustrations I was talking about. The Bhutan's gross national happiness, compassion, cultivation, training from Stanford. Then there is a mindfulness in humanitarian response, WHO and Red Cross and so on. They are training their staff on resilience in crisis zone to improve psychosocial health and operational performance. And indigenous health reconciliation happening in Canada and Australia are examples in which this inner-outer dimension are being integrated. Now I move to, I need to wrap up in 3 minutes from the time I believe that we have. Is that right?
Maybe a few more
we'll
minutes.
do it so we can discuss.
Yeah.
And then we can show back any slide that if you have a question relates to a slide in the Q&A, I'll pull up that slide and we can discuss. So now I work in a policy environment, so I should share a bit about policy and educational implications of what I've been sharing with you. So health education reforms. When teaching health, we should include the inner determinants of health. Yes, we have social determinants of health. What about inner determinants of health in medical and public health curricula, training self-aware, compassionate practitioners engaged, and so on? 1. 2. Evaluation frameworks. We should add into these evaluation frameworks spiritual well-being and collective coherence indicators. And what are they? If you look at the OECD's indicators beyond GDP as measuring progress, there's a parallel in how to develop those indicators. Global governance needs now to bring in ethics of wholeness and bring that in as dialogue for cross-sectoral coherence. And community health systems should promote secular contemplative spaces in which there are zones for quiet, reflection circles, restorative practices, and so on. So that's policy implications and educational implications. Theoretical integration, you are doing a master's degree, so you should understand as well the theoretical integration. We use complexity science, and I can, if there is time and you have some sessions that you're doing systems thinking, I'll be happy to give you a talk on complexity and health. So complex adaptive systems and health. Part of this theoretical framework is drawn from complexity sciences, where health is seen as emergent from nonlinear, co-evolving inner-outer dynamics. So inner health, outer health interacting with each other. Then we draw from consciousness studies and the ideas of collective consciousness. Ian McGilchrist has written 2 powerful books. One is called The Master and His Emissary, and that one is easier to read. The other one is called The Matter with Things. It's a big one. You will get scared, 900 and something pages. But the first one, The Master and His Emissary, is good enough, and he talks about the left brain, right brain issues, and so on. Moral psychology, inner transformations, and so on. In moral psychology, we draw also from Ken Wilber and his integral approaches to understanding the world. And finally, we draw from if you bring these together, you will really be getting a regenerative health paradigm for global health. So those are some theoretical framing or integration, but then practical integration. You can't leave it at theoretical. For practical integration, I will take a health systems approach. And the health systems approach I'm talking about is you must consider health policy at a macro level, consider the meso level, which I will call the social determinants of health, which I'm sure you will deal with. Then at the micro level, healthcare delivery, primary care, hospitals, and so on, and integrating all I've been saying at all these levels of the health system. Health industry administration, which is a kind of it's how all this whole gamut of healthcare advisors and so on who are influencing practice and policy. And finally, health financing and insurance. In the developed world, I can give you examples where you have private healthcare dominating the healthcare system, like in the US, or a single payer socialized medicine, like we have in Canada, or a mixture like we have in the UK. But overall, practical integration must follow a health systems approach. And finally, and we wrap it up here, a concluding synthesis, and this is bringing all that I've been saying to you together. Applied secular spirituality does not replace science. We work with science. It deepens the scientific, moral, and existential grounding, and so it equips, if you like, global health system to, 1, address root causes of disease, going down to the level of the psyche and the deep cultural dimensions of society. We rehumanize healthcare in the age of AI and bureaucracy. And what we are saying will work well with AI. In our recent book on AI ethics, we have a chapter called the Buddha Bot, for example. And that is an expert lady, I think she's from Hong Kong or China, who wrote that chapter. Shows that how you can get guidance, spiritual, ethical, moral guidance by talking to this Buddha Bot that she has developed. So what we are talking about can work well in this age. Align planetary survival with this awakening of consciousness. We believe that this what is missing, for example, some people say from SDG 17 goals, is a goal on human consciousness awakening. And finally, to conclude, a little quotation from Charles Eisenstein. Without inner health, there can be no sustainable outer health. Healing the self and healing the world are one movement. Thank you. Now, Q&A.
Thank you so much, Professor. This is a really wonderful presentation. I can reflect a lot on what we have already been doing in this course. We have a module on culture. We have a module on religion. We also have we are focusing a lot on human development. So this is very resonating for all of us. But I know in this group we have senior faculty members as well. We have Steve, we have Nandita, we have Sneha, and our students, including one of our PhD students. I can see him here. So I will open the floor to everyone.
Sure.
And yes. So please go ahead with your questions, comments, reflections. Okay. Yes, we have Nandita.
Right.
Hi, thank you. Thank you. Such a great talk. I hope you can hear me.
Yeah, I'm hearing you clearly, Nandita.
Yeah, so I mean, I really wanted to kind of listen in today, even though I know it's not my session, it's my session is tomorrow. I think a couple of things really, like when I was thinking about it and also listening to Abdul's introduction of, what we are covering, I think one of the really important things for me is to talk, that I work with is this understanding of the role of beliefs in people's lives and the role of, I mean, I know that Naresh, you talked about that you're talking about a more secular form of secular spirituality.
Yeah.
But I think, can you hear me? Oh, okay.
Yes.
But
I thought, like, yes, one of the important things is to obviously think about, religious organizations and culture and religion as sort of natural allies. Even though I think in our experience of delivering public health programs, we have been, particularly I speak from the perspective of, programs around sexual and reproductive health, religious groups have often not been allies internationally. So I think that tension has been there, but also I guess Abdul would have covered this also in his lectures. It's also examples where they were allies. So that kind of mixed evidence is there sort of globally. Secondly, I think Naresh, your perspective around spirituality speaks a lot to the ways in which that I think it sort of underlies the philosophy also of looking at One Health and issues around environment and the human, animal interaction. So I thought it was a very grounding, in a sense, your perspective was very grounding and sort of the philosophical nature of looking at the entire world together. So thank you so much. I don't have a question. I just was very
Thank you for those.
It was very nice for me to listen to something like this. And thank you so much for agreeing to do this for our students.
Absolutely. Thank you, Nandita, for your feedback.
Okay. Thank you. So we have Victory. Victory, please go ahead. It will be nice if you can also turn on your camera.
Thank you, Professor Naresh. That was a really good, it was really insightful. I learned a lot, and I have a lot of questions, but
Good.
I'll try to keep them to the bare minimum. So, my first question is, can inner health be referred to the same? Can it be the same as mental health? So, can inner health be seen as mental health as well? And then, my second question would be, you mentioned inner determinants of health. So, what would be examples of inner determinants of health? The same way we have social determinants of health. And then my third question would be, so you mentioned addressing issues from the root cause, and I strongly believe what you said, because I know that um, instead of handing out fish to people, it's better to teach them how to fish, right? So I strongly believe in addressing the root causes of issues. But then I want to believe that there are causes of poor inner health. So you mentioned that for us to be able to address social issues, address the root causes, we need to recognize the inner health. If I'm remembering this correctly, but I want to believe that there are things that also affect the inner health. So how do we address those things? Because I feel like it's an endless cycle, and so things like social issues like poverty affect our inner health, and then our inner health affects social issues like poverty.
Correct.
So it's like a cycle that never ends. So I just wanted to hear your perspective on that. Thank you. Thank you very much.
Right. No, that's good. And the last one is partly an answer. So yes, interesting question. So the first one, sometimes I think about inner systems dimensions. If you think about inner systems dimensions, then yes, mental health is one part of the inner system dimension. But I see mental health problems, mental health itself, fine, is an inner system dimension. But the mental health problems we are facing are caused by a wide range of causes. Many are outside and some are inside. So then in that sense, it's not only inner, right? Because, I mean, there are at least 8, 10 causes of mental health and the so-called mental health epidemic. Our argument is that one, or I think a significant contribution to addressing that is understanding one's what we call spiritual. If you don't like the word spiritual, you can call it a deeper consciousness understanding of your own consciousness and your own reality. So that's one thing. The other thing, yes, is the third part of your question about how the inner interacts with the outer and so on. These are intellectual maps that we use to understand our experience. In reality, inner-outer is one dynamic system at work. But the way we make policy and the way we train our students and the way we teach our medical doctors, in fact, most medical programs has very little. Some of them are now introducing an understanding of consciousness, an understanding of complex systems, and so on. But many of our existing physicians have not been trained like this. They are essentially trained to deal with correction of diseases. And as I mentioned, even the psychiatrists are failing to understand. I asked a psychiatrist one day, who is in fact the brother of our vice chancellor, who I met through our vice chancellor here. And I said to him, how come you guys are busy studying a self and you are treating the problems of this inner self, right? That is the source of these psychiatric problems. But you are looking for something that does not exist. What on earth are you trying to do? And he laughed. I meant it partially in jest. And he said, you're right. And Western psychiatric training is coming around now to taking on board that understanding and that reality, shown both by wisdom traditions as well as science. So that is the kind of understanding that we are infusing, going really deep into the understanding. I hope that that principle, that understanding, will answer all your three questions integrated in a way into one. But if there was a specific one I missed, please remind me.
Yes, I think the second one, I had asked, what's with examples of inner, so the way we have
Oh, okay, yes. Inner well-being, was it?
Yes. So, what would be examples of inner determinants of health?
Oh, yeah, so I'll give you some. So one of them is knowing who you are. So the first thing would be, to what extent does Victory know who she is? So if I ask you, Victory, what are you? We're going to have a little problem, right? So we begin with, and if we ask, who are you? You will tell me, I am Victory. I am from Winnipeg in Canada. I am blah, 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 blah. Long history of associations and relationships and all kinds of things. But that's not what you are. So in order to understand what you are, that depth of understanding is an indicator. Now we have spiritual intelligence. Look up spiritual intelligence, and there are indicators measuring spiritual intelligence, just like how we have IQ and EQ. You must have heard about those. We now have SQ. SQ is spiritual intelligence, and it comes with indicators. And now we have had in the past, we have all kinds of capital, financial capital, physical capital, natural capital. Now we also have spiritual capital, and we have indicators of those. If you look up the books by Dana Zohar, Zohar, you will find a book on spiritual intelligence and one on spiritual capital. And there is a recent book by Mark Vernon, I think it's the 7 Steps to Spiritual Intelligence. And there are many others, just 2 references. But that's the kind of indicator we are talking about. Also, an approximate goal is look up the IDGs. You might have heard about IDGs, Inner Development Goals. One of the 5 inner development goals is being. We don't think about being, right? We always think about doing and having. Think about your life. You spend your entire life thinking about what you want to have or what you have to do. But you are not a human doing. You're not a human having. You're a human being. But you don't think about the being. So look up the IDGs and you will see the indicators there as well. Okay?
Thank you so much. That was really good.
Okay.
Thank you so much, Professor. If we have any questions, we can take maybe. Okay, Moila.
Thank you very much. Thank you, Professor, for the well-elaborate lecture that we had. It really just went through deep for us to try and understand who we are and how our inner selves can help us in trying to solve the global health issues that we have. So thank you very much for that. I think for me, it's just a question. It's not necessarily a question, but just a contribution, because I think I like the questions that Victory brought about and how they have also tried to highlight the things that I also wanted to have questions on. So I like the fact that you have said we on the SDGs, we also have an SDG that talks about well-being, health and well-being. I think it's the 3rd SDG.
SDG 3, yes.
Yes, SDG 3, yes, health and well-being. And also the last comment that you put about to say a goal on human consciousness, which can be interlinked with the same health and well-being. It's something about awareness, to be aware of ourselves and to be aware of our environment and to be aware of others. I think it's something that it looks, it's not a simple thing, and it's something that maybe if you are not yet self-aware, you will not know. You will never know what being self-aware is until you are self-aware. Then you get to realize, oh my God, I have not been self-aware all along. So now when you reach that point of self-awareness, again, you get to understand, I still don't know more, and I still need to get to understand more things. For me, I like what you put up on the applied spirituality, which is a little bit different from how when you made the preamble on saying it's not necessarily the religious spirituality, but this is a secular spirituality, yes, which just helps us to understand things. And I believe it's something that we need to apply in global health or even in public health when looking at issues, because sometimes we remove ourselves from issues and see, oh, there's a problem there. No, there's a problem here. So if we see that the problems really come from, most of them sometimes come from within ourselves, and we see, oh, okay, maybe there's this, we apply some level of compassion, some level of empathy in looking at how certain things just are, then it will be easier for us to solve many health problems. It will be easier for us to solve many global issues, even conflicts that arises among different nations. It can be easier for us to look into those. So I am very grateful, personally, for today's lecture, and how it has really made me see deep within, and to also really get to find out, to say, hey, who am I really? I really don't know myself. I have to, yes, get deeper in knowing myself, and also having more empathy on others, as we are all on a journey to learn who we are and get to know the world around us. So thank you very much, Professor.
Absolutely. Thank you, Mawela. And see, being aware that you are aware is the first step to understanding consciousness. Being aware that you are aware is an interesting thing. And when you go deep enough and you find out and you understand that your consciousness and my consciousness is the same consciousness. There are not many. It is only one consciousness. And all of us share the same consciousness. When you understand that, here is where it leads. You know that you are not a drop in the ocean, that you have these 8 billion and I'm this little tiny dot, like a little ant running around on the planet Earth. No, it's not that vision anymore. You are now the ocean in a drop, not a drop in the ocean. See? That is where it leads. And a complete revamping of our thinking on health will have to happen. That's the revolution we are trying to forge, and we invite you to join us.
Thank you, Mola.
Thank you,
Professor. Okay, Siddharth, so be very, very specific. Turn on your camera.
All right, and I will be brief as well.
Yeah.
Yes, sir. Good afternoon, good morning, sir. Thank you so much for this wonderful session. I just wanted to understand, sir, that regarding applied spirituality, do you see it making the SDG agenda post 2030? Because as of now, as for the goals and targets, it's not a part of it. But do you see that happening post 2030 as a part of overall development?
Very good. Thank you.
I think practically what will happen is that the United Nations will bring the world together to look at some action agenda post 2030, and they might look either at 15 years or maybe 20 years, 2050, and they will probably have another set of goals or some frameworks or something. I don't think that will help, just like the SDGs have not helped very much. They have helped in many ways, so don't get me wrong. And it's not only that because we will only achieve 30% of all the targets by 2030 that they have failed. They have helped mobilization and so on. But they are still heavily dependent on energy and matter growth, GDP per capita growth. And that's an inherent contradiction of the SDGs. We have not arrived at true sustainability thinking, and we have not arrived at wholeness. We are still fragmented in our discussion. The goals themselves are interpreted by many as silos. They were not intended to be, but our thinking does them in silos, and it will fail again. So that's why we have written this book, which has just gone to the publisher. It's called From Fragmentation to Wholeness. It should be out by March. Yes, by March or April. We have written it at this time so it can influence the debate on the SDGs before 2030.
Thank you,
Professor. We have Alvin. Alvin, please turn on your camera and be very brief.
Okay.
Yes, Alvin.
Yeah, thank you for the lecture. It's so it's new to me because the Philippines is a Christian nation and we lack diversity. Spirituality gives a more inclusive environment, but it would be more is it safe to say that it is more of an individual health issue rather than a population health concern? Or is it that spirituality appropriate to influence my health priority because I'm in the policy making part of the medical field?
Okay. So I have a slide which I've shown and which you will get on how it influences policy. I have a slide on how it influences delivery, healthcare delivery, and how it can be integrated there. So there is health systems change, there is policy change, and there is theoretical change and education, how you need to be educated. All of those I have outlined practically on how they are to be done. For you as an individual, when you go deeper in becoming more aware of your own awareness and your own consciousness, it influences global health. All shifts in a set of concentric circles with you not at the center, but you as the total. You become part of the total. You are the total. That is what you will see. So this whole reductionist training that you have gotten, that we all had, has to be thrown out of the window. It'll be fun. Try it.
Okay. Thank you so much.
Thank you so much, Alvin. Steve
I think Steve is there now.
No, Steve is facing some problem with the mic. His mic is not working. I'm so sorry.
But that's a shame.
Yeah.
Okay.
This technical issues are sometimes it happens. But anyway, I think this is a very good session with all of us. We all enjoyed and we resonated with the content, the philosophy you talked about. In global health, we are trying to actually extending our understanding, bringing in the human development and capability approach. Many of these things we discuss, but I think this will add another layer to our exploration. Yeah. So
that'll be good. Excellent.
Yes, we will explore further. In fact, in our second trimester, we have a course on decolonizing global health and global health ethics. I think your recent book on AI ethics, philosophy of AI ethics, is going to be very useful. So we will explore some of the content from there as well.
Good. Very good.
Maybe we'll invite you again.
Okay, sure.
And I'm sorry, Steve is still not being able to join, but
Okay.
we will catch him later. Now I
Yeah.
will request my colleague Priyambada to formally thank all of you, and then we'll conclude. Priyambada, can you hear us?
Yes.
There
Please go
she
ahead.
is.
Hello. So, good afternoon, everyone. On the behalf of Jindal School of Public Health and Human Development, I would like to extend our warmest gratitude to Professor Naresh Singh for taking out this time for, to be honest, such a wonderful session on spirituality, health, and development. You really reminded us about how well-being kind of starts with understanding ourselves, also with creating a balance between our body, mind, and spirit, as well as the introduction part where you talked about how we have to be focusing on secular spirituality, which was a very new topic for me. This was the first time I've ever heard of something like secular spirituality.
Mhm.
And also, I really resonated with your call from moving towards a more moving from a transactional to a relational approach where we focus on wholeness restoration and not just the absence of symptoms in a person. And especially when you left us with a call for a more regenerative and integrated vision for global health, I think those are values that will be especially useful for our course and for our students as learners and as they go forward into the world as practitioners as well. Although we couldn't hear from Professor Marks, I would also like extend our thanks to our Dean, Professor Stephen Marks, for always giving us the opportunity to foster such cross-disciplinary dialogues. Also, a very heartfelt thanks to Abdul sir for bringing us such opportunities to hear on these topics, which are very useful to us. And lastly, thank you so much to the audience for being here, listening, and asking such interesting questions. I think I also learned so much from the kind of perspectives that all the participants brought to the conversation. And once again, thank you, Professor, for being here, for sharing your time and perspectives. Thank you.
Most welcome.
Thank you. So we will see you again next week. Thank you for being part of this.
Yeah. Take care, guys. Bye-bye.
Thank you. Bye bye. Take care, sir. Have a nice day.
Thank you.
Bye bye.
Thank you, sir. Bye bye.